Here, welcome to EduNet's channel. So we were discussing 2018 Kerala Assistant Professor in Nursing exam question papers. We are continuing the same here. Welcome to the part 5 edition. So let's go to the first question. Which of the following clients should be classified as a case of multibacillary leprosy? And the options are 5 skin lesions, positive slit skin smear, 3 skin lesions, positive slit skin smear, 5 skin lesions, negative slit skin smear, 3 skin lesions, negative slit skin smear. And the correct answer is 5 skin lesions, positive slit skin smear. Let us see the classification of leprosy by WHO. The WHO has classified leprosy into multibacillary or infectious form and non-infectious or posibacillary form for operational purposes. And the patients with more than 5 lesions is called multibacillary. And if there are less than or equal to 5 lesions, then it is called posibacillary. And a positive skin slit smear test will automatically puts a patient in multibacillary category. Let us go to the next question. Which biological used in expanded program of immunization should not be stored in the freezer? And the options are OPV, DPT, measles vaccine, MMR vaccine. And the correct answer is DPT vaccine. So exposure to freezing temperature is equally damaging as like exposure to the high temperature for freeze sensitive vaccines, which makes them inactive. Examples of vaccines include DPT or diphtheria pertussis tetanus vaccine, liquid pentavalent vaccine, tetanus toxoid, hepatitis A and B, human papilloma virus, meningitis C, pneumococcal conjugate vaccine, cholera, influenza vaccine, Haemophilus influenza B vaccine, inactivated poliovirus vaccine. So let us go to the next question. To prevent xerophthalmia, young children are given retinol capsules every 6 months. What is the dose given to preschoolers? And the options are 10,000 international unit, 20,000 international unit, 2 lakh international unit, and 1 lakh international unit. And the correct answer is 2 lakh international unit. So the children with xerophthalmia, measles, or severe protein energy malnutrition should be treated with high dose vitamin A. And the dose for children below 6 months is 50,000 international unit. For children between 6 to 12 months, the dose is 1 lakh international unit. And if the children is older than 12 months, the dose is 2 lakh international units. Let us go to the next question. Among children aged 2 months to 3 years, the most prevalent form of meningitis is caused by which microorganism? And the options are Neisseria meningitidis, morbillivirus, Streptococcus pneumoniae, Haemophilus influenza. And the correct answer is Neisseria meningitidis. Neisseria meningitidis cause meningococcal meningitis can affect anyone of any age, but mainly affects babies, preschool children, and young people. Let us see the next question. To improve compliance to treatment, what innovation is being implemented in DOTS? And the options are having the health worker follow up the client at home, having the patient come to health center every month to get his medications, having the health worker or a responsible family member monitor the drug intake, having the target list to check on whether the patient has collected his monthly supply of drugs. And the correct answer is having the health worker or a responsible family member monitor the drug intake. So the full form of DOTS is directly observed treatment short course. So one of the strategy aiming to improve the patient adherence to TB treatment involves the health workers, family members, or the community members directly observing the drug intake. Let us go to the next question. Which demographic tool may be used to describe sex composition of the population? And the options are sex ratio, sex proportion, population pyramid. Any of these may be used. And the correct answer is any of these may be used. Let's go to the next question. Isolation of a child with measles belong to what level of prevention? And the options are tertiary, primary, secondary, intermediate. And the correct answer is primary prevention. So let us see different levels of prevention. In primary prevention, a disorder is actually prevented from developing. So it includes activities like vaccinations, counseling to change the high risk behaviors, isolation, and sometimes chemoprevention. And let us see secondary prevention. In secondary prevention, it aims to reduce the impact of a disease or an injury that has already been occurred. And let us see tertiary prevention. Existing, usually chronic disease is managed to prevent complication or further damage. For example, in a patient with diabetes, tertiary prevention focuses on control of blood sugar, excellent skin care, frequent examination of the feet, and frequent exercise to prevent heart and blood vessel disease. So there is one more level of prevention called primordial prevention. Primordial prevention is the earliest level of prevention. It is mainly useful in communicable diseases, and it consists of risk factor reduction targeted towards an entire population through a focus on social and environmental conditions. Such measures are typically get promoted through laws and national policy. So let us go to the next question. When patients cannot make decisions for themselves, the nurse advocates relies on ethical principle of, and the options are justice and beneficence, fidelity and non-maleficence, fidelity and justice, beneficence and non-maleficence. The correct answer is beneficence and non-maleficence. Let us see each one in detail. Beneficence is the act for the benefit of the patient and supports a number of moral rules to protect and defend the right of others, prevent harm, remove conditions that will cause harm, help persons with disabilities. Non-maleficence is the obligation of not to harm the patient. Autonomy means all persons have intrinsic and unconditional worth and therefore should have the power to make rational decisions and moral choices, and each should be allowed to exercise his or her capacity for self-determination. It basically means the person have the independence to take decision whether they want to accept the treatment or refuse the treatment. For example, informed consent. Let us see veracity. Veracity means truthfulness. And let us see just what is meant by justice. So justice is generally interpreted as fair, equitable, and appropriate treatment of persons. Of the several categories of justice, one that is most pertinent to clinical ethics is distributive justice. Distributive justice means fair, equitable, and appropriate distribution of healthcare resources. Let's go to the next question. Which of the following is the most important treatment of patients with the dengue hemorrhagic fever? And the options are replacement of body fluids, give aspirin for fever, avoid unnecessary movement, ice cap over abdomen in case of melena. And the correct answer is replacement of body fluids. So replacement of body fluids help to prevent shock in dengue hemorrhagic fever. Let us go to the next question. Which of the following is an epidemiologic function of the nurse during an epidemic? And the options are conducting assessment of suspected cases to detect communicable diseases, monitoring the condition of the cases affected by the communicable disease, teaching the community on preventive measures against the disease, participating in the investigation to determine the source of epidemic. And the correct answer is participating in the investigation to determine the source of epidemic. So these are the questions for today. Let us see with the next set of questions in the next episode. So I'm requesting you everyone, if you like the channel, please like and subscribe to the channel so that you will be getting notification when the new videos are being uploaded. So let us see with the next set of questions in the next week. Till then, thank you. Bye.